watching the best. Fox 10 News at 4.
We've heard about how coronavirus can affect your heart and lungs, but what about your brain? We're going to talk to an expert about that coming up. Let's talk about coronavirus for a minute. And one of the things that researchers will be looking into for years to come are the long-term effects from the disease. Now, some of those people who have recovered say one of the lingering effects that is so troubling is brain fog. They say they're experiencing memory loss. They're having trouble concentrating. Joining us now to talk more about this is Carrie Collins-Fadell. She is the CEO of the Brain Injury Alliance of Arizona. Thank you for joining us this afternoon.
Thank you.
Tell me about this, because I've had friends who've discussed this exact thing. They just don't feel quite as sharp. They feel like they describe it as a brain fog.
Yeah, well, you know, fatigue when you've recovered from a virus can be normal, but if that lingers on for weeks or months afterwards, we're really concerned about that neurological effect, long-term and short-term.
Carrie, do we know what this might be? I mean, what manifestation of the disease would cause brain fog?
Yeah, well, COVID-19 can have direct and indirect effect on your body. It can directly affect your lungs, and then lack of oxygen to other tissues, organs, including your brain, can really manifest in a number of ways with long-term effects. So we know that it's been widely reported that about 1/3 of those suffering from acute respiratory failure from COVID are experiencing cognitive impairment comparable to those who have sustained a moderate traumatic brain injury.
Wow. Well, that's saying something. Now, could this indicate, you know, because one of the issues is respiration, could this indicate a lack of oxygen to the brain?
Absolutely similar to what you might experience during a near-fatal overdose or near drowning or strangling if you're being assaulted. We're really concerned about neurological impact. We want to get you help and treatment if there has been a lack of oxygen. And that's definitely something we're seeing here. Also, stroke. We're getting a lot of stroke patients referred to us who have had stroke during their recovery or after their recovery from COVID-19. And it's really concerning because their doctors are saying you need to call the Brain Injury Alliance. Stroke after COVID is very common.
That's really interesting. So if we were to look at this kind of long term, the people who have reported this, do we have any kind of baseline on how long they feel this brain fog? And when they say maybe after a month or two they come out of it, do we have any baseline on what the typical response is for somebody who has this?
Sure. Well, what we know about brain injury is that every brain injury is very unique. There are a lot of factors that can cause it to vary and the impact on your life to vary. So what we would like to do is apply those and look at where are the barriers to treatment for someone with TBI, because we know someone with COVID-related brain injury is going to experience those as well. You know, where are people with COVID or with brain injury getting lost in our healthcare, education, and behavioral health system? And then we know that people who have recovered from COVID and have a brain injury are going to have some of those same barriers.
Do we see this in people who have a mild case or are asymptomatic? Do they experience this?
Yeah, we are learning more every day. There are some people that didn't feel they have a lot of symptoms, but that COVID fog or that fatigue is continuing. But we're learning more every day.
Yeah, it's a vexing disease, isn't it? Thank you. I appreciate your time today, and it's always helpful. So Carrie Collins-Fadell, thank you, CEO of the Brain Injury Alliance of Arizona. Thanks very much.